To better understand Portugal's approach, we need to compare it with what other countries have done. In the Netherlands, cannabis is tolerated in small quantities, but harder drugs remain illegal. Switzerland opened supervised drug consumption rooms in the 1980s. Canada now allows safe supply pilot programs in some provinces. Meanwhile, countries like the Philippines enforce brutal anti-drug campaigns with deadly consequences. Each approach reflects a nation's history, culture, and politics. Portugal's motto remains one of the boldest and most controversial. How much does decriminalization cost, or save, a country? In Portugal, government spending shifted from prisons to healthcare. Needle exchange programs, public awareness campaigns, and outpatient treatment centers all required funding. But these investments often cost less than incarcerating thousands of drug users annually. However, some critics argue the economic benefits are shrinking as addiction resurges and more treatment is required long-term. Stigma plays a powerful role in drug addiction and recovery. In many parts of the world, addicts are treated as criminals or moral failures. Portugal tried to change that. By treating addiction as a health issue, it encouraged more people to seek help. Yet, even today, many Portuguese citizens still carry internalized shame, and public judgment hasn't fully disappeared. What about the next generation? Portugal's youth grew up in a society where drug use wasn't criminalized. Some say this led to healthier attitudes. Others argue it created a sense of indifference. Studies show mixed results. While youth drug use hasn't spiked dramatically, curiosity has increased. The real impact may not be fully understood for decades. Let's meet some individuals whose lives were shaped by Portugal's policy. Paulo, a former heroin addict, now runs a rehab center. He says, "Decriminalization saved my life. But recovery is hard work. The law can help, but it can't do the work for you." Teresa, a mother who lost her son to an overdose, believes more could have been done. We focused too much on freedom and not enough on responsibility. One policy that's gaining traction across Europe is the use of safe drug consumption sites. Portugal has hesitated to implement them. Critics say they enable drug use. Supporters say they prevent overdoses and connect users to care. As Lisbon debates opening its first safe site, communities are divided. Is it compassion or concession? Portugal is now a major tourist destination. Lisbon, Porto, and the Algarve see millions of visitors yearly. Some worry that decriminalization has painted a tolerant picture that attracts drug tourists. While the government denies this, certain neighborhoods tell a different story. Locals complain of increased begging, visible drug use, and overwhelmed public services. Addiction often coexists with untreated mental health issues. Portugal has made progress, but mental health care remains underfunded. Rehab clinics report a rise in dual diagnosis patients. Without proper psychiatric support, treating addiction is far more difficult. This is a silent crisis within the system, one that still lacks attention. Much of Portugal's progress has come not from government alone, but grassroots efforts. NGOs, churches, and community volunteers play a vital role in outreach and recovery. Programs like street methadone bans or mobile counseling units reach people where they are. But many of these programs operate on shoestring budgets, and their future remains uncertain. So where does Portugal go from here? Experts call for a second wave of reform, more funding, better training, stronger infrastructure. Others want partial recriminalization. The national conversation is shifting, and the world is still watching. What happens next will not only define Portugal's future, but influence global drug policy for years to come. In a world where millions suffer from addiction, Portugal dared to try something new. It worked, and then it wobbled. That's the nature of progress. This is not a story of success or failure. It's a story of humanity, messy, complex, and always evolving. What can the world learn from Portugal? Maybe this. Compassion without structure is chaos. And structure without compassion is cruelty. Imagine a country that decriminalized all drugs, from cannabis to heroin. A country that became the poster child for progressive drug policy. That country is Portugal. For years, the world pointed to Portugal as proof that drug legalization works. But today, cracks are showing in the system, and some are beginning to ask, did Portugal go too far? This is the full story of Portugal's radical drug experiment. The hope, the success, and the uncomfortable consequences no one wants to talk about. Back in the 1990s, Portugal was facing a full-blown drug crisis. Heroin addiction was widespread. 1 in every 100 Portuguese was addicted. HIV rates were among the worst in Europe. Prisons were full. Families were broken. Something had to change. Politicians, doctors, and activists came together with one radical idea. What if we stopped punishing addicts and help them instead? In 2001, Portugal decriminalized the personal use of all drugs. This wasn't full legalization. Selling or trafficking drugs was still illegal. But users caught with small amounts would no longer be jailed. Instead, they were sent to a panel of health professionals for treatment options. The world took notice. Media outlets praised Portugal. The UN called it bold. Drug deaths dropped. HIV transmission declined. And for a while, it looked like a miracle. In the early years, the numbers were encouraging. Drug-related deaths dropped by over 80%. HIV infections plummeted. Police resources were freed up. Public support was high. But something else was happening, slowly, quietly. As the stigma faded, so did fear. Some say drug use became normalized. And with normalization came new problems. By the mid-2010s, cracks began to appear. Lisbon saw a surge in drug use in public places. Homeless addicts began clustering in parks and neighborhoods. Drug treatment centers became overwhelmed. Portugal, once held up as a shining example, was now struggling to keep up with the unintended consequences of its own policies. In this section, we hear from people on the front lines. Former addicts, who credit the system with saving their lives. Police officers, who say their hands are tied. Locals, who are afraid to walk their neighborhoods at night. One resident in Porto said, "We wanted compassion, not chaos." A former drug counselor added, "We gave them freedom, but didn't follow up with enough support." Portugal's model inspired other countries. Canada, Oregon, even Norway studied the system. Some adopted parts of it. Others hesitated, but what most of them missed was the nuance. Decriminalization works when it's backed by serious health funding, education, and long-term support. Without that, the system begins to break. Now, Portugal is rethinking its approach. Conservative parties are calling for stricter policies. Some local governments have even started reversing decriminalization zones. A national debate is underway. Should Portugal stick with its progressive path, or admit that it went too far? The real lesson of Portugal's drug policy is not that decriminalization is perfect, but that every bold experiment comes with a cost. Portugal saved thousands of lives, yes, but it also showed how easily systems can become victims of their own success, if they aren't maintained, adapted, and monitored closely. Portugal gave the world hope, but also a warning. As countries debate how to handle addiction, one thing is clear: no solution is simple. No system is flawless. And when we stop asking questions, we stop improving.